I'm Emily Patey, and I'm going to do my head to toe assessment. It is August 25th at 7:46 p.m. I'm going to go ahead and wash my hands. And I'm going to start by, during this entire assessment, looking at the head, the neck, the chest, the back, the extremities, and the abdomen, looking at the skin for color, temperature, turgor, texture, moisture, scars, bruising, lesions, nevi, and edema. I'm going to start by looking at the head, looking at the size, the shape, making sure it is symmetrical and midline, and it is. I'm going to palpate the head and the scalp, looking at the hair distribution, color, and texture. Also looking for any tenderness, masses, lesions, depressions, or infestations, and there is none. I'm going to palpate the temporal arteries. Any tenderness?
No.
Okay, I'm going to palpate your TMJ. Any tenderness?
No.
Okay, open and close, side to side. Good. Checking for subluxation and crepitus, and there is none. I'm going to palpate the lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. No nodes are palpable and there is no tenderness. I'm going to do cranial nerve 5 if you'll bite down. Great. Checking the masseter muscle and close your eyes. Tell me where you feel this on your face.
Nose, forehead, right cheek, chin, left cheek.
Perfect. Cranial nerve 5 is intact. If you will smile, frown, puff out your cheeks, poke out your lips, raise your eyebrows. Great. Everything is symmetrical, so cranial nerve 7 is intact as well. I'm going to move on to the ears. I'm looking at the size, shape, position, making sure they are symmetrical. They look great. Palpating the pinna and the tragus. Any tenderness?
No.
No tenderness and no masses. I'm going to look in the auditory canal. No redness, and tympanic membrane is translucent and pearly gray. Same on this side, translucent and pearly gray, no redness. I'm going to check cranial nerve 8. We'll do the whisper test. You'll look that way. Repeat after me.
1, 2, 3.
Okay, other side.
ABC.
Perfect. And we'll go ahead and do the Weber test, checking for lateralization. Tell me, do you hear this more in one ear or the other, or are they the same?
Same.
Perfect. And we'll go ahead and do the Rene test. Tell me when you no longer hear this.
No.
Again?
No.
Perfect. Other side.
No. No.
Great. Air conduction is greater than bone conduction. So cranial nerve 8 is intact. Moving on to the eyes, looking at the eyelashes, eyebrows, and palpebral fissures. Also looking at the sclera and the conjunctiva, looking for color, lesions, and discharge. There are no abnormalities. Everything looks great. I'm going to check cranial nerve 2. If you'll close one eye, tell me the lowest line that you can read.
LTFPH.
Perfect. Other side.
LTFPH.
And with both eyes.
LTFPH.
Perfect. Eyes are 20/20, both sides and centrally. That was checking gross visual acuity and direct central vision. We'll go ahead and do peripheral vision. Tell me when you can see my finger.
No. No.
Perfect. Cranial nerve 2 is intact. Moving on to cranial nerve 3. I'm going to check direct and consensual pupillary response to light. Look at my nose. Perfect. Cranial nerve 3 is intact. Going to check for accommodation and convergence. Look at my light. Look at the wall. Look back at my light. Perfect. That is intact as well. And cranial nerves 3, 4, and 6, checking the conjugate gaze with extraocular motions. Follow my light with just your eyes. Perfect. Cranial nerves 3, 4, and 6 are intact. I'm going to look at the internal structures and looking for a red reflex. Great. Perfect. There are no abnormalities and red reflexes are present bilaterally. Okay, going to move on to the nose, making sure it is straight and midline, and it is. Going to check nasal patency. If you'll close one, breathe in and out. Perfect. Other side. Great. Let's check cranial nerve 1. If you'll close your eyes and cover one nostril. Tell me what you smell.
Alcohol.
Great. And other side.
Pepper.
Perfect. Cranial nerve 1 is intact. And we're going to palpate the frontal and the maxillary sinuses. Any tenderness?
No.
Perfect. No tenderness. Okay, we're going to move on to the mouth. You'll open up and lift up your tongue. Great. We're looking at the lips, teeth, gums, tongues, buccal mucosa, salivary ducts, the palate, the floor of the mouth underneath the tongue, the tonsils, posterior pharynx, and everything looks great. No problems there. We'll check cranial nerves 9 and 10. If you'll open and say ah. Great. Checking to make sure the soft palate and the uvula raise symmetrically with phonation, and they do. Intact cranial nerve 12. If you'll stick your tongue out, move it side to side. Great. Making sure the tongue is midline with no fasciculations, and it is. Okay, going to move on to the neck. Palpate the trachea. It is midline, and the thyroid gland. Feel swallow? Good. Other side. Perfect. Thyroid gland is symmetrical. There are no nodules. We're going to go ahead and palpate the carotid artery. 2+. 2+. And we'll listen for bruise with the bell. If you'll hold your breath. There are no bruise. I'm going to go ahead and check cranial nerve 11. If you will shrug against me with resistance. Perfect. That is intact. And do the cervical spine range of motion. So flex, extend, hyperextend, lateral flex, and rotation. Perfect. Range of motion is intact. Moving on to the posterior chest. So if you will face all the way this way. We're looking for any signs of respiratory distress, including use of accessory muscles, tripod positioning, cyanosis, tachypnea, retractions, or nasal flaring, and there are none. We're also looking for any obvious deformities. There's none, and everything looks symmetrical. We're going to palpate for chest wall expansion. If you'll take a deep breath. That is symmetrical. And tactile fremitus, if you will say 99.
99.
Perfect. That is symmetrical as well. We're going to go ahead and percuss in the intercostal spaces. Great. Resonance is heard throughout. We're going to go ahead and auscultate side to side in the intercostal spaces with the diaphragm. You'll take deep breaths. Good. Lung sounds are clear bilaterally. We're going to listen for egophony. If you'll say e, e, e. That is symmetrical. And we'll listen for bronchophony. If you'll say 99. Perfect. And last is whisper pectriloquy. If you will whisper 1, 2, 3. Perfect. That is all symmetrical, and there are no abnormalities. All right, we're going to do the anterior chest. We'll turn all the way around. Perfect. We're looking for any obvious deformities. There are none, and everything looks symmetrical. We're going to palpate for chest wall expansion. If you will take a deep breath. Great. That is symmetrical. And tactile fremitus. If you'll say 99.
99. 99. 99.
Perfect. That is symmetrical as well. We're going to go ahead and auscultate. If you'll take deep breaths. Perfect. Lung sounds are clear bilaterally. We're going to move on to the heart. I'm going to listen or auscultate with the diaphragm first. Aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. And the mitral valve, fifth intercostal space, mid-clavicular line. And again with the bell. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. There's no murmurs, regurgitations, or gallops. I'm going to feel for the point of the maximal impulse, which would be the midclavicular line this intercostal space, and it is. I'm going to go ahead and auscultate the apical pulse. Now listen for a full minute and note the rate and the rhythm. Okay, I'm going to go ahead and have you lie down. At a 30 to 45 degree angle, I will be looking for any jugular vein distension and pulsations, but there is none. At the clinic, I will be doing everything underneath the shirt, but for this presentation, we're going to be doing everything over the shirt. I'm looking for any heaves or lifts. There are none. I'm going to feel for a thrill in each auscultation point. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. There are no thrills. I'm going to go ahead and repeat my auscultation, starting with the diaphragm. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, the mitral valve, and again with the bell. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. No murmurs, regurgitations, or gallops. Okay, I'm going to go ahead and look at the abdomen. I'm looking at the contour. It is flat and everything looks symmetrical. I'm going to go ahead and start by auscultating for bruits with the bell, the aorta, the renal arteries, the iliac arteries, and the femoral arteries. There are no bruits. I'm going to go ahead and auscultate for vowel sounds in all 4 quadrants. Vowel sounds are normal active. I'm going to go ahead and percuss in all 4 quadrants, listening for tympany, dullness, and flatness. And tympany is heard throughout. I'm going to go ahead and palpate for any tenderness or masses. Any tenderness?
No.
No tenderness and no masses. I'll go ahead and palpate for the liver and the spleen. If you'll take a deep breath and hold it. Great. The liver and the spleen are non-palpable. If you will sit back up and stay facing this way, this way, we're going to check for CVA tenderness. Any tenderness?
No.
Perfect. Okay. We're going to go ahead and move on. You can turn to the front to cerebellar coordination. So if you will put your hands on your knees and flip-flop them over quickly. Perfect. And if you will do your serial finger opposition over and over again. Perfect. And then finger to nose. So if you'll put your finger to mine over and over again. Perfect. Cerebellar coordination is intact. We're going to do stereognosis and graphesthesia. So if you will close your eyes and open your hands. And tell me what this is.
Coin.
And this?
Pin.
Perfect. Stereognosis is intact. And close your eyes, open your hands again. We'll do graphesthesia. Tell me what letter this is.
O.
And what shape this is.
Triangle.
Perfect. The graphesthesia is intact as well. We're going to do the reflexes. Brachioradialis. Bicep. Tricep. Good. Other side. Brachioradialis. Bicep. Tricep. Great. 2 plus bilaterally. We'll go ahead and do the patellar. Great. You can turn this way. The Achilles. Great. And Babinski. Perfect. 2 plus bilaterally and Babinski is negative. Okay, we're going to close your eyes and tell me if you can feel this over the proximal ulnar prominence.
Yes.
Other side.
Yes.
Okay, and the medial malleolus.
Yes. Yes.
Perfect. All right, close your eyes again. We're going to do soft touch. Tell me where you can feel this.
Right arm. Left shoulder. Left hand. Right arm. Right leg. left leg, right foot.
Perfect. Okay, I'm gonna check the radial pulses. 2 plus bilaterally. Cap refill, less than 3 seconds. Perfect. Dorsalis pedis pulse. 2 plus. Bilaterally. Posterior tibial pulse. 2 plus. Bilaterally. And cap refill, less than 3 seconds bilaterally. Okay. We're going to move on and look at the joints of your fingers, wrists, elbows, and shoulders, looking for any redness, swelling, tenderness, deformities, nodules, crepitus, and making sure it is symmetrical. Everything looks great. Hand grasp, so if you'll squeeze my hands, great. Strength is 5 out of 5. Hand or finger range of motion, so if you'll flex, extend, hyperextend, adduct together, abduct out, thumb opposition, perfect. Wrist, you're going to flex down, extend, hyperextend, ulnar deviation, radial deviation, rotation, great. Elbows flex, extend, hyperextend, perfect. Your bicep strength pull, tricep strength push, perfect. Strength is 5 out of 5. For shoulder strength, you'll push up, pull in, great. Strength is 5 out of 5. If you will flex up, extend, hyperextend, abduct out, adduct together, external rotation, internal rotation, and circumduct. Perfect. Range of motion for shoulders is intact. We're going to move to the lower extremities, looking at the toes, ankles, knees, and hips, looking at the joints for any redness, swelling, deformities, tenderness, nodules, crepitus, and making sure that it's all symmetrical and everything looks great. We're going to do the range of motion for your toes. If you will flex, flex down, extend, hyperextend, adduct together, abduct out, great. And then for your ankles, if you can push up against me, push down against me, great. And other side, great. Strength is 5 out of 5. If you can dorsiflex up, plantar flex down, inversion, eversion, and rotation, great. Okay. Strength for your knees, you'll push up, pull in, great. Strength is 5 out of 5. And for your hips, if you can push against me, great. Push against me, perfect. Other side, great. Hip strength is 5 out of 5 as well. Okay, you'll go ahead and stand up. We'll do your knee range of motion. So if you'll flex, extend, hyperextend, other side, flex, extend, hyperextend, perfect. Hip, flex, extend, hyperextend, internal rotation, external rotation, abduct out, adduct across, and circumduct in a circle. Great. Again, flex, extend, hyperextend, internal rotation, external rotation, abduct out, adduct across, circumduct in a circle. Perfect. Turn around. We're going to look at your spine. Looking for expected curvatures and the alignment. Is there any tenderness?
No.
There's no tenderness. If you'll lean forward, we're going to check for scoliosis. Everything looks great. Okay, we're going to do the lumbar range of motion. So if you'll flex down, extend, hyperextend, lateral flex, and rotation. Perfect. And then we will do Romberg. So close your eyes. No swing. Perfect. If you will walk to the wall and walk back, checking gait and tandem gait, toe to heel. Checking the tandem gait. Perfect. If you will hop on one foot, hop on the other foot. Perfect. And while I was looking at the extremities, I'm looking for the overall warmth and skin integrity and color and any edema of the upper and lower extremities, and everything looks good. And that concludes our physical assessment.